Thursday morning, March 10th, 8:16. That's the time we talk about senior health with Dr. B, Dr. Brent Wallis from People's Health. Your kidneys play an important role in maintaining your health, but when they're damaged, they can cause a whole bunch of problems to your body. So in honor of World Kidney Day, Dr. B, Dr. Brent Wallis from People's Health joins us now to share the signs and symptoms to look out for if your kidneys aren't functioning properly. Good morning, Doc. How are you?
Hey, Tommy. I'm doing great. How about you?
I'm okay. We take our kidneys for granted, don't we?
Yeah, we definitely do, and it's a very important organ.
What's the difference between a healthy kidney and somebody having chronic kidney diseases?
So a healthy kidney is really responsible for regulating the body's water and the volume and concentration of chemicals that you have. It's really important to maintain acid-base balance and remove that acid from your body. So, that includes chemicals like drugs and food additives and all sorts of things that you put into your body. But the kidney is also an endocrine gland, so it's responsible for a lot of hormones that are involved in metabolism of vitamin D, which affects your bones, and then also something called erythropoietin, which is responsible for producing blood cells. So when you don't have a healthy kidney, we call it CKD, or chronic kidney disease. That's when the kidneys are damaged and they can't filter properly. When they can't remove that waste, it can build up in your body and cause a whole lot of problems. The CDC says there's probably about 37 million adults that have chronic kidney disease, and they don't even realize it.
What causes chronic kidney disease?
Really, the two biggest things we think about with chronic kidney disease are diabetes and high blood pressure. We talk about that a lot. So if you've got either of those conditions, then you really need to talk to your doctor about whether your kidneys are functioning correctly. There aren't any symptoms usually until damage has occurred to your kidneys. There are a couple of other causes, less common, things like kidney stones can cause problems with your kidneys, and even autoimmune diseases like lupus, vasculitis, even some certain types of infections can cause chronic kidney disease as well.
What are some of the effects of CKD?
So CKD causes all kinds of problems. It causes that life-threatening buildup of waste. You retain fluid. Your electrolytes can get out of balance. And like I mentioned, you can accumulate acid in your body. So really the biggest complications we see are heart or vascular disease, blood vessel disease, and then bone disorders like osteoporosis or anemia, like a low blood count.
Talk about risk factors, if you would.
Yeah, there's a few things we look at. Obviously, as you get older, chronic kidney disease becomes more common. There are a few ethnic groups that are more likely to develop kidney disease, African Americans in particular, but also American Indians, Hispanic Americans. But the two biggest, like I mentioned, are really if you have diabetes or high blood pressure, then you're definitely at risk for chronic kidney disease. And you can really manage those diseases to lower your risk of developing kidney problems in the future. And people should really understand that kidney disease runs in families, too. So if you've got a family member who has kidney disease, you want to talk to your doctor about your risk.
Let me take a break, Doc. When we come back, we're going to talk about diagnosing kidney disease, because that's disturbing when you said that you don't realize you have it until the kidney's already been damaged. 8:20. More when we return. Dr. B, Dr. Brent Wallis with People's Health. It's World Kidney Day, and we're talking about kidneys, and until something goes wrong, then it's serious. Time for traffic now on WWL. It is 8:26. Tommy Tucker, WWL. Thursday morning, we talk to Dr. Brent Wallis from People's Health. It's World Kidney Day. And today we're talking about the importance of your kidneys. And, Doctor, when it comes to, boy, that's a pretty severe statement that you don't know you have it until the kidneys are damaged. And we all want to prevent stuff, right? So what are some of the signs and symptoms people can look for? Yeah,
it is. It's very concerning when you can't really tell the kidney disease is occurring. So there are a couple of things to watch for, but usually they occur when the disease is a little bit more advanced. What I always talk to people about, kind of different categories of problems that they can have. Neurologically, we see people with kidney disease develop chronic headaches, depression, even really some behavioral changes. And then in the heart and lungs in particular, there's a lot of effects because of that volume overload that occurs. You can actually develop shortness of breath or chest pain, even some fluid in the lungs or around your heart, which is always very concerning. You know, in the stomach and the gastrointestinal tract, we really watch for things like loss of appetite, nausea, and vomiting. There's a condition called uremia, which develops with kidney disease, which can actually cause an ammonia-like smell on the breath or on the skin. So you have to kind of watch for that as well. And then in your blood, there's a lot of effects as well. You can develop problems with bleeding or low blood count or anemia. And then that electrolyte imbalance can get out of whack, which can cause problems with your potassium in particular, which can result in heart arrhythmias or irregular heartbeat. And then the kidney is also responsible for parts of your immune system. So people with chronic kidney disease have more trouble with infections. They can have delayed wound healing, especially if they get wounds on their hands and feet. So there's, you know, a whole bunch of things that can happen. I mentioned that the kidney also is a hormone organ, and because it's involved in producing blood, helping your body to produce blood, anemia is really a major cause as well. It can even worsen your diabetes by causing you to not be able to regulate your sugar. So there's really a whole lot of things to look for. You really hope you don't get to that stage because it means something's going on.
And you don't want to run to the doctor for nothing, but you want to make sure that this gets diagnosed if you have it. How do they diagnose kidney disease?
Yeah, I mean, you do, especially if you have high blood pressure or diabetes, or definitely both. You want to go to your doctor frequently. And what we're going to do is we're going to ask you your symptoms, especially anything that you may have noticed that changed. We'll do a full physical exam. But then there are some pretty simple blood and urine tests we can do to determine how well your kidneys are working, how well they're filtering. We can do some ultrasounds and some x-rays as well to make sure there's no obstructions or blockages. And then what we can do is we can stage your kidney disease. We stage it 1 through 5, 1 being real minor damage that we can just watch, 5 being really end-stage renal disease, which is the most severe type.
Now, let's take a break. We'll talk about treatment options when we're available. I know I see a dermatologist, and there's a dialysis place in the building, and I see a lot of people waiting for this, and it just seems like something that you certainly don't want to happen to you. But we'll talk about treatment options when we come back. Right now,
thank you, Joshua. I'm Dave Cohen. Now back to Tommy Tucker on WWL.
Thank you, Dave. And quickly back to Dr. B, Dr. Brent Wallis with People's Health. It's World Kidney Day, and we're talking about kidney disease. And Doc, what are some of the treatment options available?
Yeah, like we were saying, Tommy, the best treatment is really prevention, for this, just like a lot of other diseases. But if you do develop some form of kidney disease, like I said, it's usually related to high blood pressure or diabetes. So it's really critical that you take care of those conditions. Keep your blood pressure under control, keep your blood sugars under control as well, because if those exacerbate, that's actually going to lead to worse kidney failure. So your doctor's usually going to develop a real personalized plan for you because it's going to take into account the other conditions you have, the other medications you're taking. But what's critical is really to make sure you're following up real frequently with them, getting your blood test and your urine test done. Another thing I tell people, too, is infections can cause an exacerbation of the kidney disease as well. So if you develop a urinary tract infection or kidney stones or anything like that, it has to be treated really quickly so that it doesn't lead to further problems. We're always going to prescribe medications primarily to control your blood pressure, but some of those medicines really have a positive effect on the kidneys and can prevent them from getting worse over time. And then diet, like so many other diseases, diet plays a huge role in kidney disease. There are actually kidney-specific diets that are usually lower in protein, lower in salt and potassium that your doctor may recommend for you. And then, like everything, exercise. The exercise is going to be great if you can, be healthy, maintain a good weight. That's going to be advantageous in the long run.
Seems like it always comes down to the same stuff, huh, Doctor?
Yeah, definitely. And kidney disease is, like we said, you can progress all the way to end stage that can result in dialysis. And dialysis is very difficult for people. It usually involves going into a dialysis center multiple times a week to have your blood filtered. You may even need a kidney transplant if it's really severe. So chronic kidney disease is something, to really pay close attention to and try to avoid.
Doc, how can people find out more about People's Health?
Sure, you can always go to our website at peopleshealth.com. I've mentioned before we have a great new Medicare center that we opened on Veterans Boulevard right next to Party City at Causeway. You could come in and talk with us about any of the stuff we've been talking about or any thing that People's Health offers. We usually recommend an appointment, but you can stop by as well.
Thank you, sir. I appreciate your time. Next week, we'll move north and talk about brain health. Have a good week.
Thanks, Tommy. You too.
You bet. You can always call 1-800-978-9765, and you can follow People's Health on Facebook, Twitter, and Instagram. It's 8:42, 18 before 9. We'll take a quick break. Then we come back, we'll talk to Mike Detillier about the quarterback carousel in the NFL.